Hello, everyone. Dr. Beth Zogg with Zogg Family Chiropractic. And today's topic is why do I have to get x-rays? So sometimes when we say, this is our procedure, we'll have you come in, we'll do an exam, we'll have you fill out all your health history, and we'll send you for x-rays. People are like, I don't want to get x-rays. Why do I have to get x-rays? And so this short video is to explain to you why it's important to get x-rays at the chiropractic office. There are really two reasons why it's important to get x-rays. The first reason, and I feel the most important reason, is so that we can see what's going on in your spine, including some kind of congenital anomalies or maybe even something pathological that's going on in your spine that would totally change the way that we would take care of you. So obviously, if you had a fracture or something in your spine, we wouldn't want to adjust you in that area. So that's the number one reason. The second reason is that x-rays are a very valuable and helpful tool for the chiropractor to know where to adjust you. So I started off with this picture. This is actually my grandpa, Clay Thompson, the chiropractor from Davenport, Iowa. This is his x-ray room, and isn't it so cute? That's his office gal, who was my grandma's best friend. And so you can see that my grandpa had a very nice x-ray setup in his office on Locust Street in Davenport. Here's some more pictures that I have from my grandpa's office. So on the left, you see this lovely lady. This is actually my mom when she was a young gal. She worked in my grandpa's office. And look at that horrible outfit he made her wear. Anyway, in those days, they always took the x-rays with a head clamp to get very precise and accurate x-rays. So that's my mom there on the left getting some x-rays of her neck, her cervical spine. And then on the right-hand side, you can see, kind of like on the left-hand side, the after care, and on the right-hand side, the before care. So you can see this patient came in with a big curvature of their spine, and then after a course of care with my grandpa, then that resolved itself. So I just share this because I think it's pretty cool. This is one thing that we look at in our office, and this is called an overcompensated cervical syndrome. So what does that mean? Well, basically, this is a condition where the cervical spine has rotation of the vertebral bodies that start off in one direction at the lowest cervical vertebra, and by the time you get to the second cervical vertebra near the top, the rotation is completely switched. And so this is where an x-ray is very helpful because we would actually adjust the rib in this patient instead of adjusting in the neck. So this is just one example of how having the x-ray helps us take better care of you. Next, we have something called a spondylolisthesis or an anterolisthesis, and this is fairly common, especially in people that have done maybe a lot of sports like football or gymnasts or dancers or even baseball players that are catchers, things like that. So in this case, you can see where the lowest lumbar vertebra has shifted forward, and actually in this picture, there's what we call a pars fracture. You can see, I don't know if you can see my arrow in this video, but there's a little fracture there at the back of the vertebra, which is allowing that vertebra to shift forward. And so this is something that we would not want to adjust from the back, back of your spine. We would want to alter the way we adjust this, and if that spondylolisthesis was severe enough, we wouldn't adjust it at all. So this is not something that we can tell by your posture. You cannot, palpate this and feel that this is there. And this is another example of why x-rays are so very important for the chiropractor. Now, here is the lateral cervical x-ray, and this is a very common view that chiropractors take, and because it gives us an idea of how the top two bones may have misaligned. It also tells us, how much stress has been in that spine that has caused maybe a loss of the cervical curve. And that's really important because when you have a loss of your curve, there are a ton of studies that show the negative impact on your health because of that. And so you can see in this particular case, this person has definitely lost the curve of their neck. And so when we see this, then we have an approach to help that patient recover the quickest. And we focus on locating the subluxations that will help restore that curve of the neck. We don't want to see a neck stay like this because the weight of the head is going more toward the back of the vertebra in a part we call the facets. And the body's so smart. When you have force on a bone, the intelligence of the body is like, whoa, there's a lot of pressure and weight here. I better get stronger. And so the body will start to build the bones stronger where the forces are. Well, unfortunately, this is near the back of the vertebra where the little nerve roots come out. And this is what we would in time call arthritis, when the bone builds up around that little hole, that little intervertebral foramen. And so we don't want to see a spine stay like this. And we would adjust this in a certain way to help restore that curve. But if we don't know what the spine looks like, it's more difficult for the chiropractor to know where and when and how to give the best adjustment. These are two common views that we take of the low back, the lumbar spine. So we can see that the side view of the lumbar spine, again, that helps us look at the curvature of the spine of the low back. It should be a lordotic curve. We can look at the little disc spaces, the little darker area between the vertebra. We can look for what we call lipping and spurring, where there's a little bit of arthritic changes happening. And if you look at this person, we count from the lowest lumbar vertebra, 5, 4, 3, 2, 1. We see that this person had at some point a compression fracture at L1. So that could have been from an automobile accident, or maybe getting thrown off a horse or something like that. And so again, this is not something that we can palpate. We can't see it through your posture. We can't tell it through a leg check analysis. We need to see your x-rays. The other film is the front to back film, and here we can see a little curvature in this spine. We can see a little rotation in the vertebra here. So again, it just gives us the bigger picture of how we want to adjust the patient. And then when we follow up, maybe 3 months later, we'll do another x-ray, and we hope to see some improvements in some of those curves. At Zogg Family Chiropractic, we refer out to a local radiology center, Corridor Radiology. And the thing that I love about this center is that it's very transparent in their prices. So if you pay the cash rate, I've listed the prices here. It's only $50 for every region of the spine. So that would be $50 for the cervical spine, the neck, $50 for the thoracic spine, and $50 for the lumbar and pelvic area. So it's very, very affordable when you just pay the cash rate. They do accept insurance, and of course those would be different prices. I don't have those here, but that would be between you and them. So you would just work that out with them, whether you want to have them bill your insurance or whether you want to pay the cash price. But I'm really grateful that we have this place in our community. I mean, these prices are so good. When you look down farther, you see that they have even, MRI for, between 600 to 750. That's very affordable, especially a lot of people don't have insurance, or they have very high deductibles, where we are able, if your, case requires an MRI, we're able to send you one at a very, very reasonable price. So when you come to our office, this is where we would send you to Corridor Radiology, right there in Coralville, Iowa. As always, if you are a person that's living in the Coralville, Iowa area, I would love to be your chiropractor. Remember, my grandpa, Clay Thompson, said that the subluxation is the greatest enemy of mankind. So let's get you checked for subluxation as soon as possible.